their clients during this time. And then I know we have some folks from state food bank associations as well on the call. And just geographically, from looking at the registration list, we have people from all over the country. We do know that our resources are largely focused in California right now, but we are aggregating resources for more of a national audience. So thanks for your patience as we pull those together. And again, please share anything you have in the chat box. So let's take a minute to do the poll, and then maybe Carrie or Bethany, can you tell me when we can move on?
I'll give it another 20 seconds. Looks like there's votes still coming in. I'll share the results with everyone. Looks like majority are community partners working with pantries. It's about 27% of you, 26% from a university or college, about 11% of you with a food pantry, food bank, a couple K through 12 schools, about 12% with the county or city, and then some other partners here as well. Thanks.
Okay, great. So quite a diverse group on here. Thank you. I think now, just for those of you, since we do have some new people, I think the webinar has been shared outside our network. I did just want to give the brief 90-second version of Leah's Pantry. Leah's Pantry works in trauma-informed nutrition education. We've been working under a trauma-informed frame for 5 or 6 years, but really formally over the past 18 months. So looking at everything we do by realizing the effect that trauma has in our communities and on our diets, recognizing the signs of trauma in all places within our organizations, as well as in charitable food and nutrition education, public health in general, and then responding using our trauma-informed principles, avoiding retriggering, and then building resilience. So that would kind of be how we see our work. This is a really interesting time for us, as well as we find a new environment to work in, but that our strategic direction remains very, very relevant. So we are working hard to learn as much as we can and support our communities. Okay, next slide. We believe that everybody deserves to be nourished every day, and I think this group would certainly agree with that as we try and find nourishment during this time, realizing that nourishment is more than just nutrition. It's also social connection and relationships. And so we are pretty blown away by the amount of creativity and energy that people are bringing to their own communities and to these networks to stay connected during this time. We do 3 things at Leah's Pantry. We are direct program implementers, so we do teach classes. We do a lot of focus groups and qualitative research. We do direct support of food pantries. We also do capacity building. So we run the Nutrition Pantry program, which builds capacities for healthy client-focused pantries. We do training on various nutrition education curriculum, and we do trauma-informed nutrition support. And then last is we do bring these conversations up into the policy and initiative sector, where we're looking to make changes that reframe public health nutrition in the context of policy. Our programs, which you may have seen or heard of, are the Nutrition Pantry program, and this webinar is a component of that program. Carrie will talk briefly about it. Our nutrition education curricula are around the table and Food Smarts, and then eatfresh.org, which is a client-facing website, although heavily used by providers for inexpensive recipes. May be a great resource for those of you reaching out to clients who need to be really thrifty and preserve the food that they have in their homes during this time, or maybe starting to cook more at home after not having cooked as much at home. So looking to really leverage our resources for this time. Thank you guys again so much for coming, and I'm going to pass the mic over to Carrie.
As Adrienne mentioned, this webinar is part of or being offered through the Nutrition Pantry program. The Nutrition Pantry program is a trauma-informed program for food security, and we work with food banks, food distributions, and other agencies. Our mission is to build, support, and certify a network of client-centered and health-focused food distributions. The vision for the Nutrition Pantry program is that wherever free food is provided to communities experiencing nutrition insecurity, and notice that I say nutrition insecurity, not food insecurity, we view those as different. So food security is my tummy is full, nutrition security is that you are nourished. Wherever this is happening, the distribution is dignified and reflective of client needs. The food is nourishing and appropriate. Clients feel confident preparing and consuming these healthier foods, and pantry leadership considers the role of their distribution in the community. I think right now, that last bullet point is really what we're concentrating on. These are unprecedented times, and as you all know, food distributions and food pantries are really having to be flexible and change and best address their client needs, and that may be different than what it looked like before this. So we accomplish this through 6 different focus areas. We really take a holistic approach. These are the 6 focus areas. I'm not going to go into detail here. Depending on how much work a pantry does in this area, they may be gold or silver certified once they're through with the program. Just a quick statewide snapshot of our partners. You can see they're clustered mostly Southern and then Northern California. We have a lot of current pantries and partners who are in our network and working through the program and building that community and sharing of best practices and support. So if you want to learn more, contact us. This contact information will be shared. As you can see on the previous map, we're mostly working in California, but that will be expanding this year as we roll out nationally. So at this point, we're going to dive into some of the current situation and really fleshing out what the current challenges are for pantries. We're then going to go through promising practices that we have been seeing and that are recommended. We have a large resource document that we will be sharing with you at the end of the call. We're then going to talk a little bit about maintaining a trauma-informed approach throughout all of this. And then at the end, we really do want to have a lively chat discussion. Unfortunately, we won't all be able to have our mics on, but we do really want to hear from you. We know that, we've done a lot of research and a lot of gathering from our partners about what challenges are and what some potential resources and promising practices may be to meet those challenges. But we know that there's a lot of information from you all on the phone. So be thinking about what you might want to share when it comes to that time. So with that, I'm going to pass the mic over to Leah to go through current pantry needs and challenges.
Okay, thank you, Carrie. So we know that food pantries and distributions are really facing a unique set of challenges during this unprecedented global crisis. So as Carrie mentioned, I'm just going to take a moment to briefly cover some of the major challenges that our pantries have been facing. And then after that, my colleague Bethany is going to detail some ways that pantries can really meet these challenges head on. So first, it goes without saying that, this is a very strange time, an unprecedented time, and California and a lot of other states are currently in a shelter-in-place order. When that first came out, there was some confusion about if pantries can still operate and volunteers can go out. So I just wanted to start by saying that although non-essential services are closed, food banks, food distributions, and pantries are considered essential services, and they are allowed to still remain fully open and operational during this time. And if your site is interested in getting more details about the shelter-in-place mandate and what that means specifically for California, you can look up the California Department of Public Health website, and they have some great information, or your state's Department of Public Health website would also have information for you. Okay, so one of the biggest challenges right now is just staying informed. So most of us have already had moments feeling overwhelmed by the current situation we're facing with COVID-19, and not only because it's affecting our personal lives and our professional lives, but it's just a never-ending and constant stream of new information. And we know for our pantries, that's the same case. So they're being given new guidelines and new recommendations, and everything's changing on a fairly regular basis. And so they're really having a challenge filtering through that huge amount of new information that's coming in. And then additionally, on the client side, a big concern has been continuing to provide a way for clients to really know what's going on. Is that pantry in operation, or is it closed? Are there new emergency hours? Are they offering a distribution at a different site or a different model? And people who especially don't have access to internet or aren't as tech savvy may have a hard time figuring out the information that they need to know to get to a pantry and get to a food distribution if they need that. Additionally, with sourcing, that's a huge concern. So our pantries, of course, want to make sure they have a steady supply of food for their distributions coming in. And we have heard from partners that there has been a drop in some fresh rescue from grocery stores or retailers, and some regular donors just aren't open or operating business right now. So that has been a concern for a lot of our partners, making sure they can get enough food to come in to then give out to the community in need. And there's also been some questions over the safety of donated food, which we're going to talk a little bit. And it's really led to a high pressure on food banks to make up for what's been lost of other donor methods. Volunteers are really the backbone of most of our food distributions. And we have a lot of volunteers who are seasoned, as I always had one partner who was a senior center called all their clients and volunteers seasoned volunteers, which I love. And we know that they're a really vulnerable population, an at-risk population right now. So the question then becomes, how can pantries recruit volunteers and receive enough support for their distributions, find young, healthy volunteers, and then make sure that the volunteers who are maybe immunocompromised or a little bit older are able to assist either administratively from home or in taking a more backseat approach. And then just supplies, just as everyone's been complaining about, trying to find toilet paper at the store. I mean, our pantries need bags, they need boxes so they can pre-pack food, gloves, masks, hand sanitizer, cleaning supplies. All these items are in short supply right now, but really high demand. So it's been a challenge to make sure that pantries have enough to support their distributions. Okay, so staying safe. There are a lot of new strict guidelines related to food distributions and the best practices surrounding it right now. And of course, it's extremely important to follow these guidelines, and our pantries do know that. So sites are having to deal with enforcing social distancing. So how do I keep clients 6 feet apart? How do I control crowds at sites? How do I keep everything clean and make sure everyone's wearing gloves and masks and following all the best practices to keep volunteers and clients safe? And we know that's been a challenge. And then also, another way to protect clients is to change the distribution model. So whereas previously a lot of our sites operated a client choice or a shopper's model, right now they're moving towards pre-bagged and appointment times or deliveries for people who are unable to leave their home. So just kind of navigating having to completely change your distribution model that you already had in place and that was already running smoothly has been really challenging. Okay, and then we know that overall there's been an increased demand for distributions, but a decreased number of distributions in operation. So across the board, a lot of schools, colleges, agencies, faith-based organizations, they've been closed. So whether that's for 2 weeks or 2 months, it's really a challenge for the sites who are still operating because they are seeing an increase in demand from people who used to go to another site that's now not in operation. And then also because there's so many more people right now who are losing their jobs and their sources of income and who will need to rely on food pantries during this time to make it through. So sites are really concerned about running out of food or possibly funding if they're having to purchase a lot more goods and supplies than they usually are. And then lastly, one of the big challenges is just continuing to support and nourish clients in a really holistic manner. So a lot of pantries are more than just places to get food. They're also places to connect with your neighbor, socialize, get access to other social services and resources. So a lot of people right now are feeling that loss of connection to others, a loss of community, and a feeling of isolation. So pantries who were previously able to really foster a sense of community, which is a important practice at Leah's Pantry, or maybe they were able to receive other social services like housing, showers, job assistance, transportation, or CalFresh. Pantries are really having to just focus on volunteers and food distributions right now. So until the new normal is sort of in place, we understand that getting food to people in need and staying safe and healthy is important, but so is, still staying community connections and that sense of community between partners and clients. So with that, we're going to go ahead and move into some of the best current guidance and promising practices moving forward. So I kind of discussed a lot of the challenges, and then my colleague Bethany is going to discuss some of the ways that pantries can meet these challenges right now. But before Bethany gets started, I do just want to reference the fact that Leah's Pantry has put together a very comprehensive list of resources for clients and for partners at food distributions. So we've compiled this list from a lot of different organizations, some of which are listed on this slide right now. And it includes best practices, local, state, and federal assistance programs, volunteer resources, grant opportunities, nutrition resources. So a lot of this is California specific, but there's still plenty of resources on there that would apply to anyone, no matter where you are in the country. And it is still being added to, and it's a growing list, so please do keep that in mind. And with that, I'm gonna pass the mic over to Bethany Hendrickson for current guidance and promising practices at food distributions.
Thank you, Leah. I'm gonna quick share my screen and give it a minute. I know it sounds like it's taking a second for audio to catch up when we switch presenters. Let's see here. Okay. So yeah, thanks again, Leah. So this is Bethany Hendrickson here. I'll be sharing some guidance and tips gathered from the resources that Leah mentioned, and also from conversations with various food banks and pantries around California, some of which are on the call today. So I truly appreciate all of the wisdom that you've shared with us. So we've heard from many pantries that have already reconfigured their distributions in order to limit contact with food and other people as much as possible. And the recommendation now is if your distribution is considered a choice pantry or self-select, to move that to 100% bag distributions if possible. So if that's not feasible, some considerations are to, just bag produce or things that are high touch. We've also talked to pantries that are offering menus or checklists for clients to choose from, and then the volunteers will pack the bags. And if you are remaining a choice pantry, one consideration is having less food visible on shelves or tables for clients to handle, and having volunteers restock more frequently, again, just to reduce the number of touches. So, and if you have converted completely to a bag distribution, you might consider setting aside bags designated with certain dietary needs of your clients. So things like vegetarian or vegan bags, low sodium bags, if you're concerned about meeting particular dietary needs of your clients. And then to abide by social distancing principles, you may have to change your intake and distribution setup. That might be through appointment times where fewer clients are allowed in at each appointment slot. We've heard of drive-through pickups where clients stay in their car and volunteers deliver bags to them. You might want to take down a license plate number to connect cars to clients, when delivering bags. Or change to picking up right at the door of the pantry rather than having clients come into the door. Another important change could be to making it clear to clients that neighbors or other family members are able to pick up for clients who might be at high risk or sick. Again, to keep the food security needs being met, but also reducing that contact with sick clients. And if you have the capacity, home deliveries are an option, especially for seniors or other high-risk clients. On an earlier webinar today, we heard the suggestion, if you have limited space at your pantry, to find an off-site location to do the packing of the bags, and then delivering it to where your normal distribution takes place. So operations will likely have to change as well to minimize contact. Some options can be for volunteers to sign in for clients to reduce that sharing of pens, or use a number system. Related to that check-in process, we've also heard many pantries that are dropping any ID requirements of clients, both to reduce any sort of contact points and also to reduce barriers in accessing food. I do encourage you to check with your funder to confirm that this is allowed. Removing high-touch items from the waiting area, promoting social distancing by spreading out the flow of clients. You can do this through extending hours. Again, having clients wait in the car and texting them when their food bags are ready. Marking the waiting area with tape to maintain that 6-foot distance. But again, if you're doing that, making it clear that family members can stand in line together. Also, you might consider setting the distribution outside if it's normally a walk-through client choice system. And then, of course, extra sanitation measures. So having volunteers wear gloves and masks, possibly providing them to clients if you have any extras, or requiring that clients wash or sanitize their hands before selecting food in a client choice model. And then, of course, increasing the cleaning schedule to frequently sanitize high-touch surfaces is also recommended. So we know that diminished volunteer force is a big concern for many pantries right now. So it's important to obviously put into place put policies into place that clearly communicate to your staff and volunteers that they should stay home if they're exhibiting any signs of illness, and that any immunocompromised or older adult volunteers should be excused from their duties or encouraged to stay home. Or you could consider providing low contact jobs for older adult volunteers or those who request it. Cross-training volunteers to do multiple jobs, and taking a inventory of how many volunteers are truly essential in order to help reduce the number of workers at each shift. So how might you get new volunteers into your pantry? So one way, consider putting out a call for healthy, possibly younger volunteers through social media channels. So things like Facebook, Instagram, Twitter. If your site does have a Facebook page, encouraging everyone in your network to share that post. You can also utilize services like Volunteer Match, Create the Good to post requests for volunteers. And anything that might target high school seniors, college students, and furloughed workers who right now might be at home and also at a greater capacity to volunteer during this time. I've seen some local pantries and food banks using sites like signup.com or Eventbrite to organize this new influx of volunteers that they might be getting. Calendly is also another online resource to organize signups, so you may consider utilizing some of those services. And we also know that many pantries have completely closed their operations, so contacting them to reach out to their volunteer network may be another source of volunteers for you. And your local food bank is likely the best place to get contact info for those agencies. So sourcing more food or replacing the food that's no longer coming in is definitely a challenge. What we're hearing is that many food banks are tapping into their emergency reserves of food or using funds to buy more food to meet that need. So for pantries, it's really essential to communicate to your local food bank how your needs for food have changed and if those needs are increasing. So for those that have lost grocery rescue or other partners, I think Leah mentioned that there are some safety fears going on around donated food. It's important to communicate that there's currently no known risk of transmitting coronavirus through food. In the resource list that we'll send out, we have a number of resources around food safety and the coronavirus. One is an FAQ from the USDA that kind of clearly communicates this. Another is an open letter that was authored and signed by a number of experts that debunk some of these concerns and strongly encourages donations to continue. And this was provided by North Carolina State University. Again, for any sites that have closed, calling on them to share any donation contacts or leftover food resources is another strategy. We've seen stories of pantries reaching out to local restaurants that are either shutting down or might have leftover food from their takeout operations, or might have farmers or other supply partners that have excess food. That's another strategy that we've been seeing. And then our resource list also has a handful of emergency funding opportunities. So unfortunately, they might not be useful for needs that you have today or even this week. But considering applying for those extra funds might allow you to continue your operations longer term. And then what we've heard from some of the food banks is that they are making extra shelf-stable foods available. So you may want to make a decision to shift towards those more shelf-stable foods, especially if they're possibly more affordable. What we've heard is that the CDC might be urging people in the near future to prepare for the possibility of self-quarantining for 2 weeks. San Francisco Marin Food Bank has started sending people home with 3 to 5 pounds of extra shelf-stable goods. And it's really for clients to prepare for that possibility of being homebound for 14 days. So some ideas to keep your volunteers and clients informed of any changes include making announcements on any social media pages you might have, making sure your website is updated or any other pages where you have your information. So places like 211, updating your local food bank with any changes in hours or distributions. Phone trees are also useful for communicating changes with volunteers or staff. This may also be a feasible strategy for any distributions that are run through housing or other services where there might be a smaller set of known clients. Putting updates in food bags, maybe it's a half sheet of paper that just updates on things like changes to hours, changes to distribution, could also be another communication strategy. And it's important to not just update on changes to things like hours, but also to communicate any differences the clients might experience in your distribution. So, if they're used to going through a choice pantry, making it clear, whether through signage or through, a volunteer that's greeting them at check-in, that they will be experiencing a change in how they're used to getting service. That's always reassuring to clients and, keeps your process transparent. So if you've been hosting any nutrition classes or food demos on site, absolutely in California, those have all stopped, any in-person gatherings of that sort. But if you have contact information for any of the participants that were in your classes, you can share resources like our website, eatfresh.org, that Adrienne mentioned, for recipes. We also have our eatfresh.org mini course. This is 15 different lessons of 5 to 8 minute videos in English and Spanish. They're on a variety of different nutrition education topics, and those are free for anyone to use, but that might be a great way to keep clients engaged and your nutrition ed participants engaged as well. So you might also consider providing information or handouts to both clients and volunteers on expiration dates and shelf life extensions, both to answer any questions about how long food may last, or if a food item is near its posted use by date or a couple days past its use by date. These handouts are useful to reassure clients that there is a safe extension on many of these items, and that these handouts are in our resource list that we'll be sending out later. So we already know that for many families, a food pantry won't be able to provide all food needs. So if you can gather information on other sources of food, I know that would be a huge resource for your clients. So things like any available schools, ways to get meals for seniors or other meal distributions. I just want to point out that there's a fantastic app, the California Meals for Kids app. We were alerted to this by California Association of Food Banks. This lists all all school sites in California that are providing free meals for kids. So alerting your clients to that information as well could be useful. Looking up other nearby food distributions that might have additional hours, and other resources, things like how to sign up for CalFresh, unemployment benefits, maybe another useful resource for your clients. And then this is also, an opportunity to use and grow your network. Some of the real bright spots in this uncertain time, I'm sure that many of you have been seeing, is just how, individuals and communities are coming together to help each other. People want to help. So this is really a time to lean on your network and make that call, exploring existing collaborations or new collaborations, whether it's through things I mentioned, restaurants in the area, clinics in the area, taking a fresh look at some of these potential collaborations to support your clients and your distributions. You might also consider, taking on other distributions or an existing emergency service, possibly providing extra bags during those school meal drop-offs as well. So there's a real opportunity for collaboration here. And last, if you cannot keep your pantry open, or pantries that are not able to stay open, providing that resource list of pantries in the area that are remaining open, connection to other resources of food, like I mentioned in the previous slide, and resources for CalFresh and other social support systems. And then it's important to provide clear communication on why you are closing and how you will let them know when you reopen. You can invite clients to provide phone numbers and give you permission to contact them when you do reopen. Again, opportunity for collaboration and communicating to clients, agencies that are open and available for your clients to utilize as well. So with that, I'm going to pass back over to Carrie. I'll stop sharing my screen and pull up the slide.
Okay, great. Thank you, Bethany. So we're going to talk just a little bit about remaining trauma-informed during these times. So obviously right now we're trying to meet the most basic needs. We're trying to provide food for an ever increasing number of people who find themselves in need. This is unprecedented, and we want to do the best we can to meet those basic needs while also still trying to keep in mind some of our trauma-informed best practices. Typically, when we talk about acknowledging the trauma of our clients, we're looking back in history and considering what a person may have been through previously. But now it's really important that we acknowledge that this current situation is traumatic for many, and not just the clients, but also staff, volunteers, community members. This picture here shows kind of the 3 different areas that we may look at for types of trauma. And pandemic isn't on here, but I think would clearly fall under this environmental area. In this current state of heightened stress and trauma, it doesn't take much to send somebody over the edge. So this is where we would think about our window of tolerance. Our window of tolerance in the middle, that's when you feel like you can deal with whatever's happening in your life. It's the ideal place to be. But as stress and trauma shrink that window of tolerance, it doesn't take much to send you off. It's kind of that proverbial last straw that broke the camel's back, right? And so it's important for us to realize and to truly acknowledge that many people are in this kind of shrunken window of tolerance. It's important that we do what we can for ourselves and also for those that we serve to increase that window of tolerance. So getting support and help can expand it and help us to better deal with some of our challenges. Protective factors can help with this as well. These you'll notice here, obviously good nutrition is something that pantries can typically provide for those to help build their protective factors and help to kind of increase that window of tolerance. But community connection as well. This is something that's been mentioned before. That's something that pantries have provided for many of their clients and also for their volunteers, right? And that's been may have been an important part of their own self-care and their own protective factors to deal with their stress and what's going on in their lives. But that's a lot harder now with social distancing. So we're going to talk a little bit about how we can still try to pull that in a little bit. And I just want to point out and kind of pause here and say how incredibly important it is for those working and volunteering at pantries to also practice the self-care and use of protective factors. They're all doing incredible work, and the communities are extremely grateful for the work that they're continuing to do during these times. So the 5 R's of a trauma-informed approach, we've established so far that we need to realize that we're currently in a traumatic situation for many individuals. And we need to also recognize that many may have a shrunken window of tolerance as a result. And responding with patience and compassion and providing these protective factors for those becomes that much more important since we're kind of currently experiencing that situation right now. We're going to touch on some specific ways that we can respond with a trauma-informed approach and hopefully accomplish the next R, resist re-traumatization. Before I go into those specifics, I just want to kind of lay some groundwork and just briefly introduce or review the 6 trauma-informed principles. We're not going to talk about these in detail, but just so you know that these are kind of your basic trauma-informed principles, and some of what we talk will be built off of that. So right now, especially safety and trust and transparency are really important. Also, that building of community and connection, connecting with compassion, which really covers a lot of the other 6 principles. So at the most basic level, we all need to feel safe. And now more than ever, the physical safety is so important. And this isn't just for clients, but this is also for volunteers and for the community. Many of these pantries are operating in a space that is open in the community. There may be a residential area, it may be a parking lot where the community members are near to that parking lot. And we want the community to feel safe as well, even though a pantry is being operated there. So it's very important to follow all of the best practices and promising practices that Bethany went over earlier to really establish and maintain that safety, that physical safety, and to let others know what you're doing about that, to have that communication, right? You do want to pay attention to specific community concerns if you have any. Pantries and distributions, like I said, they're operating in all different ways in all different spaces, and the community does have a voice in that. So make sure that you are listening to the community. And you may need to adjust some of the recommendations as needed for your pantry. Every setup is different, and just logistically speaking, you want to get creative about what the safest way is to deliver the food at your pantry. Bethany also discussed best practices for communication. And again, I just want to emphasize how important this is to maintaining a trauma-informed approach. So right now there's increased uncertainty, and this makes good and transparent communication even more important. So some things that we want to be transparent about may include what the pantry is doing to maintain safety, why you're making changes to your operations, simply acknowledging the things that you don't know right now or what things may change. And then if you do have to close, being transparent about that process. It's also important to establish two-way communication, listen to your clients, observe their behaviors, do whatever you can to still get some feedback from them. Obviously, we're not going to ask them to sit down and fill out a survey or come to a focus group, but try to keep some of that communication open, even though people may not be, wanting to slow down and talk to you right now. Ask open-ended questions if given the opportunity, and really try to listen to what people are saying rather than trying to rebuke or explain away their concerns. Finally, we need creative solutions. So we have complicated problems going on right now. At the most basic and obvious level, we're challenged to serve the most at-risk populations. And so how do we accomplish this while keeping them safely sheltered in place as well? This includes seniors, unsheltered, and other at-risk communities. We also see a lot of volunteers no longer being able to volunteer, or maybe not feeling safe to volunteer. And this is a form of self-care for many individuals. So how do we still provide that opportunity so that they can maintain their health and well-being, and so that they can safely and comfortably support the distributions that are serving these individuals? Social isolation is a problem for so many right now, and even more so for those who are in some of these at-risk communities, especially seniors. So how can we increase some connections and compassion and decrease this social connection or social isolation? We've got, some creative ideas here. We would love to hear more from yours. Some pantries already have a really established social media. For some pantries, that's not the best solution because their clients aren't on social media. Maybe use of videos and even FaceTime, or some sort of video chat, having, check-in calls from volunteers, for example. In a lot of the pantries who we work with, when, they come early and wait in line, but that's social time for them. And sometimes we even hear from pantries when we reduce the amount of time that clients wait in line, the clients are a little unhappy because they don't get that social time, right? And so if they're not getting that there, and they're used to seeing a certain volunteer or certain individual, trying to make other ways to digitally connect and to support that. Maybe having a social phone tree where, you sign up and then each person calls the next one in the tree. Anything that we can do to kind of build that connection and maintain that during these times will be very helpful from a trauma-informed approach. So now I want to leave time for questions and discussion. When you had registered for this webinar, we asked some questions about, what your challenges were. And we tried to focus our topics and the resource list that you'll be receiving on ways to fix those challenges. But there's lots of things that we weren't able to fully answer. I think, the bullet points on the screen right now are ones that were especially challenging. And so I'd love to hear in the chat box if you have any other creative solutions to some of these or other challenges maybe that we did not discuss or touch on at all. Okay, now the chat box has been quiet, so I'm hoping I haven't totally frozen. Okay.
I see someone typing. Apologies.
We did want to have this more of an actual discussion, but just didn't feel as though the platform would be able to support that. Okay.
I think Carrie is going to mute her audio. It sounds like there was some funny interference there, but please continue putting any questions or resources to answer some of these questions that are on the screen here in the chat box. For those that are on the phone, and there's a lot of great comments coming in, I'll share some of what people are talking about. Let's see if I can catch up. Okay. So one question came in, has anyone implemented a transportation of meals or food bags plan? We have seen some pantries that have started to do transportation mostly with volunteer cars. One comment also said to possibly utilize services like Lyft or other kind of current food delivery partner services. I know that they're trying to do some workarounds with making some exceptions or providing some extra funding to use some of these existing food delivery services to deliver emergency food to clients. A comment came in that local papers could be a great way to let people unfamiliar with distributions know where and when they are. Also consider contacting local news stations, especially for older adults. Paper and local news are common ways to get information. One comment came in that I'm with CalFresh Healthy Living. Some of our educators who are no longer able to provide direct ed services are volunteering at food banks and meal deliveries. That's awesome to hear. Anyone who is healthy and well enough can use their time to volunteer. Another comment that California Association of Food Banks is leveraging money from the state to purchase and deliver shelf-stable boxes of food. That's great to hear. I know that there are food banks, and CAFB definitely are really pushing for extra funding to make some of those deliveries and to purchase extra food happen. Comment that Meals on Wheels needs volunteers. Another comment that expecting volunteers to absorb the cost of fuel to make deliveries is difficult. We have a service area of 160 square miles. That's absolutely a legitimate concern, and not an easy cost to absorb. If anyone has any suggestions on how to fund some of those costs or any other funding opportunities for especially rural communities, please put those in the chat box. So a comment and question, how do we give valuable information in the food bags that would be real-time information for recipients? I wonder if giving references to a Twitter page or the Ready San Diego app would help. I think that's a great idea, especially sites that are regularly updated with real-time information. So for your county, the Ready San Diego, even the food banks have done a pretty good job of updating their pages with relevant information for pantries, at least, may also be relevant for clients. How can senior volunteers support yet not be present? That's a great question. And if anyone has anecdotes of what their senior volunteers are doing, we'd love to hear that. All right, let me get... Adrian, I'm going to pass over to you too. I know you've been hearing a lot of great anecdotes and suggestions from other pantries and sites.
Yeah, can you hear me now?
Yep.
Okay, hi everyone. This is great. I think just want to transition to let you know what we've been talking about behind the scenes during the webinar. We're going to have the resources on our website, on the NPP page and the home page. I think we're going to link the webinar slides as well as when we get the audio recording into the resource document itself. So there's just going to be one place for the links. We're also going to take a look at this chat box and start to pull out all of the great ideas that are coming out of this. Churches, that's a great idea. I just saw Cynthia give that suggestion. I think the marketing issue is really coming through in terms of how do we let people know quite a bit. And I think, engaging these senior volunteers, I had all sorts of questions about whether we could have a video chat with the senior volunteer that always greeted people at the food bank and kind of put their video face up and just make people feel connected with who they're used to seeing. I just know there's so many different ways that this can happen. I saw City of Riverside posting the list of all pantries, school meal resources. We've heard a lot about that. So we're at our time block at 11 o'clock. I know everybody's super busy. We are going to go through the chat very carefully. We're going to aggregate the resources and we're going to get things out for you as quickly as possible. If you're still typing and still want to chat, we're not going anywhere. We will continue to aggregate information via the chat. And I think the resource document may already be up on our website, but we are going to send out an email in a few minutes. And I think the marketing issue, how to let people know and how to communicate with them information is probably one of the most emergent things that I've seen on here that we will definitely address in the resource guide. Trying to scroll through here to see if there's anything else we haven't talked about. But thank you guys so much for jumping into this and giving us and being patient with our audio. I think we are at the super max for this platform, and all of our bandwidths are also at the super max as everybody's now transitioning to video. So hopefully that wasn't too annoying and you guys did get some great information, and we're really grateful to all of you out there working hard. It's very inspiring, and we look forward to continuing the conversation over the next, I don't know how long, over as long as it takes. Oh, lots of thank yous coming in. No, thank you guys. Yes, Tanisha, it will be a resource list of all the information. Okay, thank you, everybody. I see people dropping off. Hi, Maggie. Lots of familiar names on here. Okay, send an email. Okay, so one of the pantries we work with sent an email with 55% decrease in donations. Yeah, so it sounds like volunteers, really figuring out how to bring in new volunteers safely into the pantries. Jacqueline, can your organization be added to the food resources? We're providing hot meals and groceries to seniors, as well as our food pantry being open. Yes, yes, we will share the PowerPoint. We do have information in Spanish, and we will link the Spanish resources as well as the English resources to the food waste. Eatfresh.org is also available in English and in Spanish. I know that in the resource guide, they have linked Spanish information when it's available. So we're trying to get a sense of how much is translated. I don't think it's all of it, but quite a bit of it has been translated, at least into Spanish. And yes, Karina will share their PowerPoint directly in the resource guide. Can vouchers be produced to use at designated open farmers markets? That's a great idea, Deanna. We do vouchers with some of our projects through Finney, but I don't know about expanding that, but I think that's a great idea since farmers markets are still open. Yes, Cynthia, we're going to aggregate all the suggestions from the chat section, and we'll put those in the resource guide as well. We'll clean it up a little bit. We may also create use our maybe ACEs and Nourishment group in order to continue to facilitate this conversation. I think there's potentially some connections that could be made between the people on this call. So we're going to talk about that right after we get off the phone and see how we can get you guys continuing to share ideas and emergent suggestions with each other without having to go all the way through Leah's pantry. Okay, a couple of people still typing. Okay, oh yeah, there's our contact info, npp@leahspantry.org. I think a lot of you have logged off, but this is an easy way to reach us. Yeah, we got you, Antelope Valley. Thanks, Jacqueline. Yeah, it looks like you just put your Facebook page in there, so that's got the most updated information, I imagine. Yes, perfect. Yeah, it's easier to, I think it's easier for people to update their Facebook pages than their websites sometimes, especially for community organizations. I don't know of school meals being offered to elderly individuals, but I do know that congregate meal sites are generally grab and go in San Francisco and probably other places. So for elderly individuals, I would look for congregate or home delivered meal sites that are run through your county office of aging. And they should have resources specifically for older adults, probably not only in California, but I think in other places as well. They've been incredibly responsive to this situation. No, thank you. Everybody's working hard right now. Thank you, Denise. Glad that it was useful. Okay, Chris says her school district is using their buses to deliver school meals to the rural students. This allows them to keep their bus drivers working as well. Yeah, I've heard stories of this too, which is great. Really reduces the burden on kids that are living really far from the school they attend. I've also, batching the meals too and giving out a week's worth at a time as opposed to just one day at a time. Okay, glad to see that's happening up in Tahoe. Yeah, I think the rural counties and the urban counties and as always, there's always a different strategies that work, but we're definitely seeing that as well here. And the kids that can't make it to the bus stops to pick up food, they can go to the schools as a drive-through and pick up breakfast and lunch. Okay. Yeah, I think it's just multiple strategies, right? Like not one thing is going to work for everybody, and it depends on if you've got a parent home or a parent at work, and Okay, I'm seeing a quiet chat box now, so I think we're going to say goodbye, stop the recording, download the chat box, and then kind of get to work cleaning up all the amazing information we've just received. Thank you guys so much, and we will talk soon.